line with a state mandate, New York City is preparing to move its 1.2 million Medicaid beneficiaries into managed care plans. Is the healthcare system ready? How will the change affect Medicaid users? I'm David R. Jones, president of the Community Service Society of New York, a nonprofit organization that seeks solutions to problems affecting the poor. Today on the Urban Agenda, we will consider these and related questions. We are fortunate to have as our guest Victor Robles, council member from Brooklyn. Mr. Robles is majority whip of the City Council and chair of its Health Committee. Victor, this is a very important discussion we are having here, but I'd like to get some understanding from you about how the Health Committee and what you're focusing on for the City Council. You've taken it to new heights.
Well, let me just say that I've been a member of the Health Committee for 14 years since I came to the Council, and I must say that I came from the state legislature as a member of the Health Committee for the 6 years I was there, because as I grew up in Williamsburg in North Brooklyn, I must tell you that my mother, may she rest in peace, we had to rely upon the public health system, the public hospitals, the what used to be called public health clinics, so that if I needed a hospital, I could not afford the luxury. And in those days, there was a hospital called St. Catherine's Hospital, which, because I didn't have the proper insurances, not that I could not go there, it's just I just didn't have the means. So I relied upon what used to be called Greenpoint Hospital. Sure. Second, when I needed my immunizations and my chest and that, it was 151 Morger Street, the Department of Health clinics. So I start with the premise that there was a reason why, although I'm not a health expert, that as a New Yorker, as a son of someone who came here from Puerto Rico, truly it was the public health system that today, if I'm such a big shot majority whip and chairman of the Health Committee, it was because of having accessible and there the kinds of health services that I needed, even though at that time people would say I was a poor person. Having said that, I chose to give up the committee that I used to preside, which was the Youth Service Committee, because I was concerned with the direction that the City of New York and the Council, in terms of public health hospitals, public health clinics, and when I see us talking about privatization, and to this date, as a member of that committee for 14 years and now as chair, I have yet to see anyone convince me or justify that we should do away with the Health and Hospital Corporation, or for that matter, the public health clinics, then I have a concern. So having said that, as the new chair, I intend to refocus and make the Committee on Health focus on what our mission as a health committee is about. It's about our public health services. And since we're coming close to the year 2000, the census, and every 10 years we have a census, and every 10 years we're supposed to have a head count, and that then gives us where we should use our resources, why we should use our resources, who represents us, and it's a whole host of things. Then I chose to set and begin to set the direction of the Health Committee. So let me just share with you the direction. Number one, I believe that the Commissioner of the City of New York's Department of Health is the Chief Health Officer and is supposed to be the advocate to set the tone, not only the Health Department, but the City of New York. By the way, that same commissioner under this administration is also the commissioner of the Department of Mental Health, Mental Retardation, and Alcohol Services. By the way, that same commissioner sits on the Health and Hospitals Corporation Board of Directors, and by the way, happens to be the chairman of the Quality Insurance Committee of that corporation. Now, having such important positions, then why are we in such dilemmas? So what I hope to do is to say, stop, folks. Let's look at the charter. Let's look at the responsibilities. And whether we like it or not, unless you change the charter itself gives the opportunity for people who cannot afford to secure or to seek medical services, that they could feel that they can go to somewhere and still get the services, although they may not have the kinds of what we call the proper credentials to get it.
Right. One of the things that we've been working on, both my staff and myself with you, is the issue of this new HMO environment that's going to be affecting all these Medicaid recipients. As you begin to have hearings and the rest, what's starting to come out in terms of your committee's
Well,
work?
let me again try to set the tone.
Right.
Unfortunately, this whole health system, this new phenomena, has come so fast, and we're still trying to understand and weave out what does it mean. And that's us, the professionals. What about those who are the recipients? Mm-hmm. So that while we all agree, and you and I agree, it's here. There is the good old days, and how it operates is no longer, but we have to make sure that whatever the past did provide us, that the future still guarantees us that we still are part of the fairness. So that when you started and you opened them, you talked about a 1.2 million Medicaid beneficiaries who will now either voluntarily or when you, because you lack the information, the education, the understanding, will now be forced to be placed in a MHO, then I think we have an obligation. You know, government is of people. And whether we like it or not, we're still in a democratic government, which government has been the place that people can turn to so they can look to and at least get guidance and direction. So we in the council, working with groups like yours, sat and we discussed about where are we and where are we going? What does it mean for the now and what does it mean for the tomorrow? Well, when government decides to mandate, because that's the key, we're still waiting upon when do we mandate where now you have no choice. Right. We felt and we agreed that one of the things we should not wait upon is when that decision is made. That clearly we know how many people will be affected, and that we should do something so that collectively the Managed Care Consumers Assistance Program, which is what you're talking about, of which the council placed $1.5 million, is to not only address the 1.2 that we already know, but there are a lot of other undocumented, uninsured, that the numbers might be greater. They may qualify, and so those numbers may grow, and yet they don't even know what you're talking about. Right. So my hope is, again, a census, clearly the city of hope and opportunity, clearly the language is not English, clearly it's not just minorities coming from the West Indies or the Caribbean. We have now a large Russian Jew population, so that the language is not just the earmark to the third world. There are a lot of other places where traditionally our ancestors came to. I think we have an obligation to assist wherever possible, and I think this is what this program does. It takes local community-based organizations who works every single day with those that we are talking about, and have a relationship, has a good dialogue, communicates on equally with the language where one may come. And all they're doing is helping government so that when that mandate finally comes, then those numbers, we might see the real numbers. And you and I know, because we grew up in New York City, every 10 years there is a number, yet those numbers are not the real numbers. We are always undercounted. So that's where my hope is. And working with groups like the Community Service Society, which is a group that is very respected, and of course, I must tell you, I'm really honored because never did I ever dream that one day I'll be sitting in front of you. We grew up together in this town. Our parents were mutual friends. So for me, it's really an honor and a joy to sit before you and begin to say how we are the sons and daughters of those who paved the way. And if I'm doing anything and you're doing anything, we're doing no more, no less than that which was done by our parents. The only thing we're doing now is we're implementing, we're putting our money where our mouth is.
Well, I think one of the, just going on the kind of path you were, clearly the number of immigrants coming to the city as legal immigrants, 110,000 new immigrants every year, like clockwork. Many of them working people, almost all of them working people. But if a medical crisis hits, at this point, they may not be insured. The Congress, in its wisdom, specifically excluded many of them from Medicare coverage and Medicaid coverage.
But excluding them does not mean that we do not...
Absolutely.
We don't inherit the dilemma.
Right.
They're going to go somewhere.
Yep.
They're going to seek wherever possible. The point that I'm trying to make is the one place that they have always turned to, and we better understand that, it has not been the volunteer sector. It has been the public sector. It has been the hospitals of the Health and Hospice Corporation. It has been the public health clinics. So you are correct. And so when you ask me what the direction, yes, I know what legally is the numbers. What I don't know is what will be the actual impact on the services of the city of New York with those numbers that are not counted.
We should just lay out for the audience some of the key parts of the Medicaid Care Consumer Assistance Program that you and the council members under your leadership have brought forward. It will basically be an educational program to tell people over the phone or in person about their rights in managed care. And I think one of the things that the council members urged on us and other advocates, that it's not only limited to people on Medicaid. It'll be for private pay people who run, I hear all over the place, and I'm sure you and your work here, that they need help too. It will help them to get the care that they have every right to get under the law. It will help refer them to other resources if necessary. It will be a program that will, if necessary, actually advocate for the individual. It's literally interesting that the City Council should back this now, and important, because the only other program of its sort is out in Los Angeles. We think that New York again can blaze the way. I was talking to some legislators upstate. I talked about all the other issues that I see in New York. But when I got to this issue of the Ombuds program and needing to, they said our constituents are beating down our doors because they're having trouble in the managed care.
Because I come from that, I used to be in the state legislature,
right.
And one of the things that we constantly hear is the upstate, downstate. Well, right now, this is an area that we're all in the same boat. We're either going to understand it, we're either going to help each other, or, see, the bottom line with this whole scenario is whether people, by right, have the right to seek health care. And there are two ways of doing that. There is, like you said, those that perhaps are covered properly and can decide which facility they go, whether they go to a
right.
public or a voluntary. But then there are those who cannot. Let me also point out something as you raised this, which caught my attention. That you put out a report recently,
right.
And what disturbed me was that in your report, I wasn't disturbed with you, that 30% of those that are already registered, see, those are the ones I'm talking about.
Right.
They don't even know what are the benefits they're entitled to.
Yeah.
They don't even know how to secure it, how to get it. Now, if 30% before the mandate I referred to
Right.
are now registered in some kind of managed care, and they don't know, what happens to those who don't even know that it's coming? So I have to commend the Community Service Society for reaching out to us, and I want to say for the record too, while I appreciate you singling me out as the chair of the Health Committee, I must tell you that I took this responsibility at the direction of the Speaker of the Council.
Right.
And if it were not because Speaker Peter Ballone wholeheartedly, and remember, I inherited this, this program should have been already up and running.
I know.
When I was directed to and I got appointed as chairman of the Health Committee, there was a certain priorities that was given to me. For example, our asthma initiative was a council initiative that today, for the first time now, we finally, in an area, are dealing with. This managed care, very important.
Right.
And so, yes, I thank you for, and I think you know me, that when I am given the responsibility and to lead, in this case, like the Health Committee, I intend to, and I take it seriously. But if it were not because of the strong support that I have, and I know I have, and that's why, not to be cute, when people actually, when people come to me and tell me about the proposed plan for the fiscal year 2000, takes out whatever good we intended to do, it's not there. Well, I will tell you that there is a commitment to make sure that as we negotiate the fiscal year budget of 2000, that we cannot ignore a viable program that in the long run, we may spend $1.5 million, but it gives back to us 3 times the fold of what we spent. Now, in this mentality of today with administration, not just the city, the state has it. And believe it or not, also the Congress has it. It's not just the Congress, it's even the president. When the mentality is that we should shrink, who's against shrinkage? But who will be affected is the question. And so long as this country, and so long as the state, and so long as the city of New York continues to be the land of the free and where opportunities happen, then I will tell you that we have an obligation and we are committed to working with you and groups like yours to deal with the issues.
It's very interesting as we talk about it, some of the language difficulties people are having already. Many of the viewers may not know, but basically the HMOs that are going to be working with Medicaid, particularly, do not see other kinds of patients. They're called Medicaid only. And often, as we should, as you know, I've been involved in private businesses as well, your issue is to make return for your investors. It often leads to some real problems if there's no watchdog element. And that's, I think, when we talk to you at the council and the council leadership, they understood immediately that there have to be intermediaries to make sure that little people who have language difficulties or are very old, who have handicaps, can at least have something to negotiate a system. And I think most of us know, I don't know about everyone in the audience, but I challenge people generally to have they read their own HMO plan. And everyone glazes over, because I think just from having a private HMO plan, a pretty good one, we're finding the kinds of complaints that come back are just what a Medicaid person has. And they would be getting on the voicemail and, you know, punch one for, you know, if you have a complaint, being left to wait for hours, or turning up at an emergency room because you've slipped and fallen, or your relative has, and being told that you can't come here because you have to go to your primary physician first, and trying to negotiate that, or getting emergency service and then finding that your HMO won't pay the bill because they didn't pre-qualify the emergency room visit.
Or you can qualify, you can pay, yet the bureaucratic red tape sometimes discourages you.
Right.
And I must confess, as a member of the council and as a public official, you know, this is not about just poor folks.
No.
Because I'm supposed to be one of those who are supposed to at least be fortunate to be more knowledgeable. I must tell you, and I won't even tell you which one I have covered, but I take the most simplest because I don't have the time to be punching those numbers.
Right.
So if I do that, and I'm supposed to be the one who's supposed to know how to read and write and do all the things that they say those people, I think that this whole thrust, and the point also I want to make, somewhere along the line a decision is going to be made. And automatically people will be put into a MHO, and they don't even know that it was done.
Right.
And I think this program is not about popping up any community-based organization. It's about, again, getting a heads up, doing a real outreach. You know, government, and I'm part of government, and I'll take blame too. We try, we attempt to do that, but we haven't been successful. And although it's out of the area, but the fact is, look at the New York City Police Department as a good example. We will now be spending close to $10 million, which is not in the plan, to do what we should have done all along. Well, what I'm saying in healthcare, and that's why I'm happy to join you, is I'm not waiting until there's a crisis. I'm not waiting until the doors close in our face and then say what we should have said. We know already. See, the frustration is we know it. We've been hearing it's coming, it's coming, it's coming. Matter of fact, if I remember correctly, there has been suggested dates that were supposed to implement it. And then when the dates came around, somehow, because we can't get our act together, and I don't mean just locally, state and nationally, then it gets pushed and pushed. Well, you can only push so much, because those that you already have convinced are now saying, what am I waiting for?
Yep.
So I want to be clear, and I want to again, the council is not pushing for a subsidy just to hand out. The council is pushing because we believe that you cannot deal with this changing health care
Without
system
good information.
without giving the kind of information not only to the poor indigenous people, but there's a lot of those of us who have made it we're trying to wrestle out of understanding what it is.
It's interesting as you talk about it. One of the things about that I think all of us in the advocacy community and just walking around people liked about the new HMO environment is, at least as it was painted when it was first presented, it has some great things about it. It's better than, should be better than the fee-for-service Medicaid services that people get in emergency rooms where they have to wait for hours on end. It was required that everyone get a baseline physical. And that was one of the most disturbing parts of our early report that led us to bring some of this issue to you and the members of the council. So many people never were even requested to come in and do a baseline physical, to start looking at their entire health condition and actually lowering costs. If you do this right, you get a primary care physician, you get people who are getting immunized, they're getting their kids to checkups and the rest, and they catch symptoms early, you can lower costs for everybody. You can certainly help the person lead a much more productive and happy life, and you don't have these acute situations that cost, you know, hundreds of thousands if you don't catch it. And that was one of the more egregious failings that we found, that many of the Medicaid providers have not been providing this up front, not getting their patients checked out. So we hope that consumer education can not only, you know, be the tough guy forcing HMOs to follow the letter of the law, but really bringing about what everyone hoped was going to come out of managed care. The best of all possible worlds, improved quality. In other words, we have a healthier population, and also at the same time, if you do it right, lower cost. And it can happen, but people and government and the not-for-profit sector and the HMOs can't play games and come up with short-term
But
profit.
I guess I have to wear my political hat,
Right.
because again, today at City Hall, when I say today, I mean today the thinking is that we're giving away a $1.5 million. And as you're talking, my light keeps lighting. Why? If you do not catch it, you do not route, you do not do the things you need now, then what is going to be the cost?
Costs are going to be huge.
If you're talking about doing as much as you can, so those who say we're spending so much in the medical, or at least the health arena, well, what do you do, like you said, to, one, do it early, so that in the long run, the cost will be less. Now, if 1.3 in a $33 billion budget, and when I came to City Hall 14 years ago, and if I got $100,000 in the budget, I will tell you that to me it was the greatest thing I did, because in the 6 years I was in Albany, in the Assembly, I don't believe all my projects did not come to be equal to that $100,000. That's how cheap they were. Now, when I now, after 14 years, look at when we discussed what I call the pencil pushers, you
Right.
know, the financial people.
I've been there.
And when you talk about cuts and you say 2 million, 5 million, 10 million, or we spend 10 million in overtime, I sit there and I says, can you imagine what I can do with just $1 million in my community? So if the issue at hand is that the administration and its plan, instead of really joining with us and letting it see first, I love to evaluate first. Maybe you guys are not doing it right. But how can you stop something when you haven't even started?
Right.
And that's the tragedy. So now in the plan of the mayor for the year 2000, automatically before you're up and running, that money is out of the budget. Well, my position is, you have not convinced me, I don't mean you, the administration has not convinced me, that this council initiative, at the request of community-based organizations giving us the facts, that you have shown us that they started it, that you gave them a time to show you that what they said is, and then if you come back and say to me, you know, we spend this money, and this is what we got from it, and then you want to pull it out, so be it. But how can you start something, or how can you take out something when you haven't even started?
And it's particularly true because when you talk to the administration right on, they're the ones who bring to us some of the problems they're having in the HMO environment. They know that on all levels, income levels and program levels, that this is any startup, as you've discussed, there's going to be some problems that you have to monitor closely. And to make sure quality is improved, but also that the city isn't being ripped off.
Right.
I mean, tax dollars are going out in billions of dollars in healthcare services through HMOs. This is our money that's going out, and this is another standard of monitoring.
You keep repeating, because I don't want to give the impression to anybody that all of a sudden somebody's giving us something.
Right.
We're not getting free anything.
No.
Someone pays for it. And you know who, for the most part, in terms of these numbers and the uninsured, you know who pays for that? We, the government. Right. Who's the government? The people.
Taxpayers.
So I understand, and that's why I said clearly, including the community-based organization, that we all agree. Evaluate. See that they're doing it. But you can't already cease when you have not even given them the opportunity. And the other point I'd like to make is that, you know, I guess because after so many years in the council, you get frustrated. I always love where accountability. And I, for one, believe in accountability. But when you are using the accountability and you do it across the board, then I'm willing to accept it. But when I see layers, and the police department, again, is a good example,
Sure.
where a lot of money is being spent and there's no accountability, then there's some of us are saying, wait, you know, you're hypocrites. I believe this program can work, must work, because in the long run, it's about people. It's about people's lives. It's about people's health. Either we do it today, or we suffer the consequences tomorrow.
Thank you, Councilman. The first step into a health maintenance organization can be scary for anyone. When you don't speak English or have a physical or mental handicap, that fear can be magnified 1,000-fold. That's where the Medicaid Managed Care Consumer Assistance Program comes in, providing aid and comfort to patients maneuvering the system. The City Council is to be commended for having the wisdom to support MCAP. So for all their grateful constituents, I'd like to say thank you. This is David R. Jones for the Urban Agenda.
To comment on the Urban Agenda or for more information on CSS, contact Community Service Society of New York, 105 East 22nd Street, New York, New York, 10010. Area code 212-254-8900.